Hello students, welcome back to your nursing lecture series. Today we are going to learn a very important topic, that is menopause. Menopause is a natural biological process marking the end of women's reproductive years. Menopause एक natural biological process है जो हर woman की life में होती है. It's not a disease, rather it's a normal phase of life that every woman experiences, usually between 45 to 55 years of age. It is not a disease but a normal life stage which marks the end of reproductive years. Usually menopause between 45 to 55 years of age के बीच में होता है. Means after this age women की जो ovaries हैं वो eggs बनाना बंद कर देती हैं and menstruation permanently stop हो जाता है. Definition: Menopause is defined as the permanent cessation of menstruation resulting from the loss of ovarian follicular activity. Menopause means the natural stopping of a woman's monthly periods. It happens because the ovaries stop releasing eggs and stop making hormones like estrogen and progesterone. Clinically, it is diagnosed after 12 consecutive months of amenorrhea, means no menstrual period, without any pathological cause. If a woman doesn't have her period for 12 continuous months and there is no other medical reason, then we will call it menopause. ठीक. Now, age of menopause. Average age 50 years, early menopause means before 40 years, late menopause after 55 years. Usually it occurs between 45 to 55 years of age, but कुछ women में थोड़ा early या फिर late भी हो सकता है. Exactly ऐसा नहीं है कि हाँ इसी age में होगा. Early age means before 40, जैसे उन वुमेंस में होता है जिन्होंने कीमोथेरेपी ली हो या फिर जिन्होंने ओवेरियन सर्जरी कराई हो, उनमें अर्ली मेनोपॉज होता है. लेट मेनोपॉज मीन्स आफ्टर 55 ईयर्स. ज़्यादा कॉमन नहीं है बट होता है, हेल्दी और एक्टिव वुमेन में होता है. इन्फ्लुएंसिंग फैक्टर्स: जेनेटिक्स, न्यूट्रिशन, स्मोकिंग, हेल्थ स्टेटस एंड लाइफस्टाइल. जेनेटिक्स, अगर उसकी मदर को अर्ली मेनोपॉज हुआ है तो हो सकता है उसकी बेटी को भी हो. ठीक है. न्यूट्रिशन में अगर पुअर न्यूट्रिशन है, स्पेशली लो प्रोटीन, आयरन एंड कैल्शियम इंटेक, दैट कैन ऑल्सो कॉज अर्ली मेनोपॉज. Smoking. Smokers often experience menopause 1 to 2 years earlier. Health status and lifestyle. Stressful lifestyle or chronic illness can also affect it. Now, physiology of menopause. Normal ovarian function. What are the normal ovary function? Okay, ovaries contain thousands of follicles that produce estrogen and progesterone under the influence of FSH and LH from the pituitary gland. Normally, ovaries make estrogen and progesterone under the control of FSH and LH. What happens in menopause? With age, ovarian follicles are depleted, less estrogen and progesterone. The hypothalamus and pituitary sense low hormone levels. FSH and LH levels rise due to loss of negative feedback. As the woman gets older, ovarian follicles become less and less, so estrogen and progesterone level decreases and FSH and LH levels increase. Then menstruation stops. Phases of menopause. There are 3 phases of menopause: premenopause, perimenopause and postmenopause. Premenopause means period before menopause, when cycles become irregular. Period starts becoming irregular. It usually starts in the late 30s or early 40s. For example, Mrs. Anita, जिसकी एज 42 है, and she says पहले मेरा पीरियड बिल्कुल रेगुलर था पर अब कभी 20 डेज में आता है और कभी 40 डेज में आ रहा है, and that is a sign of premenopause. Okay, many women ignore these early signs thinking it's a normal stress, but as a nurse we must educate them that it might be start of the transition. Okay, now second, perimenopause, climactic period. Perimenopause means time around menopause, usually 2 to 8 years, when hormonal fluctuation cause physical and emotional symptoms. Hormonal levels fluctuate drastically during this phase और symptoms जैसे hot flashes और mood swings start होने लगते हैं. For example, Mrs. रेखा complains that कभी मुझे रात में पसीना आता है and गुस्सा भी जल्दी आ जाता है. That's a perimenopause. ठीक है, ये transition period है. Climactic period मतलब कि means the phase of transition from the reproductive to non-reproductive stage. This stage continues until 1 year after the last period. Third, postmenopause, phase after 12 months of amenorrhea, means permanent cessation of menses. After 12 months of no period, this is permanent. Now the woman can't get pregnant naturally. In this phase, ovaries completely stop releasing eggs. Estrogen and progesterone are at their lowest levels, and FSH and LH remain high. Remember, menopause is not a sudden stop, but a gradual transition through these three phases. Each woman's experience can be different depending on her hormones, health, and lifestyle. Our role as a nurse is to educate, support, and empower women to maintain their health and confidence through every phase. Okay, hormonal changes. What are the hormonal changes in a menopause woman? Estrogen decrease, progesterone also decrease, and FSH, LH increases, and androgen also may increase slightly. Sign and symptoms of menopause: vasomotor symptoms, hot flashes, night sweats, palpitations due to sudden vascular instability caused by estrogen deficiency. स्टूडेंट्स मेनोपॉज के सिम्टम्स मेनली ड्यू टू लो एस्ट्रोजन के ही कारण होते हैं, ठीक है। जैसे हॉट फ्लैशेस, नाइट स्वेट्स, पाल्पिटेशन, ये सब सडन ब्लड वेसल्स के चेंजेस की वजह से होते हैं, ठीक है। साइकोलॉजिकल सिम्टम्स: मूड स्विंग्स, इरिटेबिलिटी, एंजाइटी, डिप्रेशन, फॉरगेटफुलनेस, इंसोमनिया, ये कॉमन है इस स्टेज में, ठीक है। menstrual irregularities, irregular skipped periods before they stop completely, पीरियड्स इरेगुलर हो जाते हैं फिर कम्प्लीटली स्टॉप हो जाते हैं। यूरोजेनाइटल सिम्टम्स: वेजाइनल ड्राइनेस, इचिंग, पेनफुल इंटरकॉर्स इज कॉल्ड डिस्पेरिनिया, urinary frequency, urgency, incontinence due to atrophy of urogenital tissues. Vaginal dryness, itching, painful intercourse, urinary frequency or urgency. It is also most common in menopause periods. Skin and hair changes: dry skin, loss of elasticity, hair thinning, brittle nails, skeletal changes. Osteoporosis means bone loss due to estrogen deficiency, back pain or risk of fractures. It is also most common in menopausal women. Cardiovascular changes: estrogen is protective, so after menopause, risk of heart disease and high cholesterol increases. 8. Weight and metabolic changes: weight gain especially around abdomen, and metabolism slow हो जाता है, okay. Now complication of menopause: osteoporosis, cardiovascular disease, urogenital atrophy, psychological problems, anxiety, depression, sexual dysfunction. For example, many postmenopausal women visit clinics with back pain, joint stiffness या मूड स्विंग जब इस स्टेज के पार्ट्स हैं, ठीक है। Diagnosis: clinical diagnosis based on history of 12 months of amenorrhea, age above 45 years with typical symptoms. Second, laboratory test if needed. Lab tests help confirm menopause when symptoms are unclear, especially in early menopause. FSH increases more than 30 international units per liter, increase LH, decrease estrogen, and thyroid function test to rule out hypothyroidism. Thyroid test to rule out other causes. Okay. Management of menopause: reassurance and counseling, explain that menopause is a natural, normal life stage, encourage open discussion about symptoms and feelings, explain to the woman that menopause is a natural process, not a disease, encourage her to share her feelings and symptoms freely. Okay, lifestyle modification: eat calcium and vitamin D rich food like milk, curd, paneer, eggs, etc. Regular exercises, walking, yoga, weight bearing activities. Stop smoking and reduce alcohol. Maintain ideal body weight. Hormone replacement therapy used for severe symptoms, for example, hot flashes, osteoporosis prevention. Combination therapy: estrogen plus progesterone is given. Risk: risk may increase chances of breast cancer, thromboembolism. Should be used under supervision, should be under medical supervision. Combination of estrogen plus progesterone is given, but remember, it should always be under doctor's supervision because long-term use can increase risk of breast cancer or blood clots. Non-hormonal treatment: SSRIs or clonidine for hot flushes, calcium and vitamin D supplements for bone health, lubricant or estrogen cream for vaginal dryness, alternative therapies, herbal remedies, soy, flaxseed, phytoestrogen. Phytoestrogen मीन्स ये प्लांट से एस्ट्रोजन मिलता है, ठीक है. एक्यूपंक्चर, मेडिटेशन, रिलैक्सेशन टेक्निक्स all help to reduce symptoms. Nursing management, assessment, record symptom, menstrual history, emotional status, education, teach about menopause as a natural process, advise on diet, exercise, and calcium intake. Third, counseling, give emotional support, reduce anxiety and fear. Health promotion, encourage regular pap smear, mammography, bone density test. Support groups, open discussion about sexuality and self image. Encourage women to join discussion or counseling groups for confidence. Okay, these are nursing management of menopausal women. I have completed this menopause topic. So thank you for watching my videos. Bye.